How many visits should you expect from hospice care? And what does Medicare require from hospices? Understanding these requirements can help set clear expectations during these sensitive times. Registered nurse RN visits. Initial assessment. An RN will conduct an initial assessment within 48 hours of the start of hospice care to evaluate the patient's immediate needs. Comprehensive assessment within 5 calendar days. A thorough assessment is completed to develop a personalized care plan. Ongoing visits. The RN will visit regularly, with the frequency determined by the patient's individualized care plan, which is reviewed and updated at least every 15 days. Supervisory visits. If hospice aide services are part of the patient's plan of care, a supervising RN must make an on-site visit to the patient's home at least once every 14 days to assess the quality of care and services provided by the hospice aide and to ensure that the services meet the patient's needs. Notably, the hospice aide does not need to be present during this visit. Physician visits. Certification and recertification. A physician must certify that the patient is terminally ill with a life expectancy of 6 months or less. Recertification requires a face-to-face encounter with a hospice physician or nurse practitioner before the third benefit period, after 180 days, and every 60 days thereafter to assess continued eligibility. Hospice aide visits. Personal care. Hospice aides provide personal care services such as bathing and grooming based on the patient's needs as outlined in the care plan. Social worker and counselor visits. Support services. Social workers and counselors offer psychosocial and spiritual support with visit frequency tailored to the patient's and family's needs. Continuous home care. Higher level of care. Continuous home care is a higher level of hospice care provided during periods of crisis to manage acute medical symptoms, allowing the patient to remain at home. Eligibility criteria. To qualify for continuous home care, the patient must require at least 8 hours of care within a 24-hour period, with more than half of this care provided by a registered nurse RN or licensed practical nurse LPN. This care is intended for brief periods to manage acute medical symptoms. In summary, registered nurse RN visits. Initial assessment within 48 hours. Comprehensive assessment within 5 days. Ongoing visits as determined by the individualized care plan. Supervisory visits every 14 days if hospice aide services are included. Physician visits. Certification of terminal illness. Face-to-face recertification every 60 days after the initial 180 days. Hospice aide visits. Personal care services based on the care plan. Social worker and counselor visits. Support services tailored to patient and family needs. Continuous home care, provided during periods of crisis with at least 8 hours of care in a 24-hour period. These guidelines ensure that hospice care is personalized to meet each patient's unique needs, providing comfort and support during these sensitive times. For more detailed information, you can refer to the Medicare Hospice Benefits Booklet or the Code of Federal Regulations on Hospice Care.